Good morning, everyone. Thanks for tuning back in again. Been a really good night last night. It's my first of 3 nights, which I'm doing a 2 to midnight, as I'm doing a slowly return to work, phase return. So I'm still a little bit tired this morning because I didn't get in until 1 o'clock this morning, due to being half an hour overrun. But that's the way it is. You supposed to be finished at 12, but inevitably we have to put petrol in and things like that, so we don't actually finish until 5:30, but that's okay, that's fine. And at the end of the day, as long as the patients are okay, that's the important thing. Right, I have had a question from a Neil Rapson. Thank you very much for your question, Neil. So a big shout to you. Hello. And you're asking about how much what is it I do as an ECA, and things like a Cat 1, what is my role? Okay, so as an ECA, we do everything the paramedic would do, except we don't have the responsibility of a registration, which means ultimately the decision to do something is the paramedic's decision. And the other thing is, we don't do the drugs. Okay, so because the paramedic themselves is registered and has the degree or the diploma or whatever qualification they have, which is obviously over the ECA qualification, they have been taught how to use the drugs and when to use it, and the pros and cons of each drug to each problem that the patient has. That's something we don't touch. We are allowed to draw up sodium chloride solutions. We are allowed to draw up morphine, but the actual administration of that drug is not permitted as an ECA. If you've got a paramedic who've been working with for a very long time and you've been doing ECA work for quite some time, like a couple of years, then they allow you to do other bits and pieces on the vehicle, but technically we're not allowed to administer physical drugs except for oxygen and O2, oxygen and Entonox. Okay, but everything else, the driving, the attending, the paperwork, the tests we have to run through with the patient, that's all done. We do that as well. We do the ECGs, though when we put these ECGs leads on, it's the paramedic who's got the training who knows how to read it. Okay, I myself want to go and read an ECG and understand it. I mean, that's perfectly normal for other ECAs as well. We're quite happy to try and learn about how to read an ECG, though it's not in our remit to do so. Okay, it's just above and beyond what we want to do, because for me personally, I want to move on to be a paramedic. So the more I can try and fit in this noggin, the easier it's going to be in the long run. So that's basically what we do as an ECA. We do everything except for what the paramedics is only registered to do, and the ECA is not registered to do. A Cat 1, so a Category 1 call, is the most urgent. That is a confirmed arrest. That is something that is, we need to get there within like 8 minutes or before. That is the most urgent case for whatever reason. Someone's having difficulties, has swallowed their tongue or something, and they've got minutes to live. That's sort of a proper sort of Cat 1. And with a Cat 1, we do the same thing again. We are assisting the paramedic. We are taking the responsibility of the patient in the way of making sure the airway is open, things like that. But the paramedic will intubate them. Or if the paramedic says, don't bag valve mask them, I want you to pump on their chest, then we'll do that. Whatever the paramedic is asking us to do with a Cat 1, we are there to assist the paramedic. Okay, so basically the paramedic and the ECA are a symbiotic relationship. We work together in order to achieve the common goal. The paramedic needs the ECA on the truck, so if there's a patient in the back, the paramedic will go with the patient in the back. If the patient's very, very poorly and could go down any time, the ECA will drive. However, if the patient is not so poorly and is just feeling a bit sort of meh, and there's no immediate danger of them crashing or anything like that, like someone's fallen down and hurt their arm, or not feeling very well, has been diarrhea and vomiting or whatever, then the ECA can go in the back and the paramedic goes in the front. But if it's something which is acute, or something which we are not trained to minister to help with at that moment in time, like for example, if someone crashes, if we're in the back of the vehicle, and so Joe Bloggs is fine, and he's had a football day or something, he's felt a bit sort of shortness of breath, but he's actually okay. He's just because he's got asthma or something. It could be that the ECA can go in the back if he seems to be okay, or the paramedic may say, I'll go in the back instead of you drive. However, if the ECA is in the back with them, and the and the patient crashes or declines quite rapidly within minutes, then the ECA will then notify the paramedic and say, help, stop the vehicle, come in the back, need your help, something's happened. Okay, so there's always help there. Patients or people change. It can change within minutes. And you should never take anything for granted. Someone might look absolutely fine, but inside they may be changing quite drastically, and we can't see it on the outside until we put the ECG on, or if we've checked their SATs at all. So we have to treat as you see as the biggest thing that I've been taken away from this. So yeah, Cat 1s. We are then there for the paramedic. We are there to drive them to the scene, or if the paramedic is driving at the time, they can drive to the scene. But most likely, we will be the one who drives the patient to the hospital if it's a confirmed Cat 1, because the paramedic will need to be in the back with the patient to stabilise and make sure they are stable. Okay, so I'm hoping that's helped you a little bit there, Neil. Any questions, then please obviously keep the questions coming through. If I don't know, I will find out. I'm still quite new at this. I've been I finished a year ago now almost, so I completed my course a year ago. So and a year is not a lot of time as an ECA. I think by year 2 you pretty much know what you want to do and how to do it. But so I'm still quite sort of green about the gills, as green as my uniform. Okay. Anyway, I will catch you later. It's morning time, so I'm going to drop the kids off and I'm going to go to work. Okay. Have a great day, and I will see you soon. Take care. Bye bye for now.